Welcome to my practice. My name is Richard Bernstein. I'm an orthopedic surgeon specializing in hand and upper extremity surgery. I grew up in the greater New Haven area, went to high school at Hopkins Grammar School. From there I did my medical training at the University of Connecticut. From there I went to Boston to do my fellowship in hand and upper extremity surgery. I chose the program in Boston because I have three main interests. First is trauma, second is pediatric, and third is rheumatoid arthritis and other inflammatory arthritic disorders. The fellowship at Boston was at Peter Ben Brigham Hospital and Boston Children's Hospital, part of the Harvard program. This program allowed me to hone my expertise in these three areas. Boston Children's Hospital is a premier hospital specializing in orthopedic disorders, especially those of hand and upper extremity. Second, the Peter Ben Brigham Hospital, part of the Harvard program, specializes in rheumatoid arthritis and other types of inflammatory disorders. Finally, the hospital treats Harvard medical students, residents, and faculty. Serving the Harvard emergency room allowed me to take care of traumatic injuries of the hand, wrist, and upper extremity. From there, I returned to New Haven. I was the first fellowship-trained certified orthopedic surgeon in private practice in New Haven. Within 3 months of coming back to New Haven, I was able to limit my practice to disorders of the hand and upper extremity. I found there was a significant need in this community for that, and in the last 18 years, I've been able to specialize in hand and upper extremity disorders for kids, adults, and the elderly. I currently see patients in New Haven, Brantford, Milford, and Hamden. I returned to New Haven because of my interest in teaching. At the time I completed my fellowship, Yale was building their children's hospital. This would allow me to take care of kids and teenagers with hand and upper extremity problems. I have a clinical appointment in the Department of Orthopedic Surgery at Yale. Through my association with the university, it's allowed me to teach medical students, residents, and fellows. I'm also involved with teaching allied health professionals, X-ray students, and physician associate students, not only at Yale, but also Quinnipiac. I've become involved at a national level with the American Society for Surgery of the Hand. One particular program that interests me is the so-called Lending a Hand program. This is a program set up by the American Society for Surgery of the Hand to help medical students learn about hand and wrist anatomy. The program coordinates with the anatomy department at the School of Medicine, and consequently, I'm able to go into the anatomy lab and teach medical students about hand and wrist anatomy. My practice has fortunately continued to grow, and I treat all disorders of the hand, wrist, and upper extremity. I've maintained my interest in trauma, not only treating fractures, but patients with ligamentous and tendon injuries. I also perform microsurgery and arthroscopy of the hand and wrist. I've maintained my interest in rheumatologic disorders and have set up a bi-monthly teaching program with the rheumatology department at Yale. Through this bi-monthly conference, I've been able to teach the rheumatology fellows about hand and wrist disorders. Recently, this program has been picked up by the American Society for Surgery of the Hand as something that I will sponsor to other programs across the country. Finally, I enjoy treating kids and teenagers with their hand and wrist trauma and congenital abnormalities. This has maintained as a big part of my practice. I was fortunate to become associated with a hand surgeon in Florida who developed a new technique to treat fractures of the wrist. Because of the aging population and osteoporosis, fractures are unfortunately all too common. Fractures of the wrist, the so-called radius bone, the second most common bone that is broken. The technique of fixation has now become standard of care. I've been asked to lecture both nationally and overseas regarding this technique. I've been fortunate to teach medical students, orthopedic surgeons, and other hand surgeons on this technique. I've been invited to the American Japanese Hand Society, the Southeast Orthopedic Society, Dartmouth, Thomas Jefferson, to name a few. I've found the opportunity to teach fellow practitioners an extremely rewarding experience. On a national level, I've become involved with the American Society for Surgery of the Hand, which is the governing body for hand surgeons across the country, is well recognized across the world. I've been chairman of the Residence Fellows Committee, the Scientific Exhibits Committee, and have also served on the annual meeting committee as well as the publications committee. The Hand Society has asked me to co-edit a book on arthritis. I'm currently writing a chapter on ganglions and other common disorders of the hand. I'm thrilled to be a member of the orthopedic group. I'm confident in my ability and that of my partners to provide the highest quality orthopedic care to members of the greater New Haven community as well as patients referred from all over the country. Our staff is extremely supportive. I'm thrilled to be working as a team with them to provide the best care to you and my other patients. I feel we have the most wonderful staff, and as a team, we can provide the most support to you for your orthopedic problems. I look forward to meeting you.